Hello, welcome to Unpacking Life's Crazy. I'm Esperanza Phoenix, and today's topic is EMDR Therapy, or Eye Movement Desensitization Reprocessing Therapy. And if you haven't been to my podcast before, a brief introduction. It's called Unpacking Life's Crazy because I happen to be a disabled artist who is dealing with some mental and physical disabilities. I cover a lot of topics on this podcast. Sometimes they're personal, sometimes I do interviews with some really cool people. And if you're returning, thank you for coming back. It's been a while. I'll explain about that in a moment. If you haven't yet subscribed or liked my podcast, please push those buttons and like and subscribe. And you know, if you're new and you're like, I don't know if I like this podcast yet, it's okay. Like and subscribe anyways, because you know, it gets viewers, it helps people get their eyeballs on my stuff, or if you're listening, you know, like it in that way. And if you decide later you don't like it, it's really easy to undo, so no biggie. And as I said, I am disabled, so the only sources of income I have are either this podcast, if I am able to monetize at some point in the future, or selling my artwork on Etsy. So as a little bonus, if you like, subscribe, leave a little cheerful comment, or have questions that you want to post, that would be great too. And I have a little opportunity for you. I'm going to be giving away one of my original sculptures, and this little piece is a mushroom plant ornament. I also make ornaments for trees as well, do a lot of mushroom crafts. The artwork you'll see in the background is mine as well. So out of those people who follow the instructions, like, subscribe, leave a comment, I will be doing a drawing and giving away this cute little plant ornament before the next podcast. So that would be really awesome. All right, so before we get on to the main topic, there's a few reasons why it's been a little while since I posted. This is mostly for the regular viewers, but just so you know, since the last podcast, which I believe was the interview with my daughter, Kira, who happens to be transgender, well, summer happened and I fell into doing some swimming instructions. That was unexpected, but one of the exercises that's easiest for me to do and that I enjoy the most is swimming, because it's easy on my body with my fibromyalgia. So I happened to be at the apartment swimming pool, and a lovely woman asked if I could open the gate because she wanted to show her little boy around. I said sure, and so she started asking me questions. One thing led to another, and I wound up teaching her to swim. She was 31 years old. She tried twice and was successful. We're good friends now. We go out to coffee. And then while I was instructing her, a couple other people saw what I was doing. So I wound up giving swim instructions to 3 adults and 2 children. Also, I got diagnosed with COVID feet. Well, pandemic feet. A lot of people have been having problems with plantar fasciitis since the lockdown. Not wearing shoes around the house was my main problem. You know, not getting up and walking around as much. I'm not sure exactly. Probably also tied in with the fibromyalgia and other issues that I have. But that led to some physical therapy, having to deal with that diagnosis. So that wasn't a lot of fun. Another new diagnosis, and this one's a mouthful. My rheumatologist, who I see for the fibromyalgia, diagnosed me with non-radiographic axial spondyloarthritis. Yeah, I said, would it be better to be rheumatoid arthritis? Because it's just really easier to say, but no. So I have started a new treatment, which is Cimzia. It's a biologic which involves injections. That's like getting my immune system to stop attacking my own joints or something. So I started dealing with that. And then the daughter, Kira, who, if you followed the podcast, I did the interview with, 2 interviews with, unfortunately, she suffered an emotional setback. So she went through a really hard time in October, and it was quite some emotional turmoil. She's doing much better now. I'm not going to go into it. Perhaps if she's ready, she'll come and do another interview and discuss what she went through. And I'm also coming to terms with my ADHD. I'm not officially diagnosed again. I was diagnosed as a child, and it was just one of the many learning disability things that sort of fell off the radar and wasn't dealt with. There was a time they sent me to school with a thermos of coffee. It wasn't very helpful. They didn't have all those fancy ADHD drugs back then. So organization is an issue for me. Getting back to the podcast has been an issue, and then my boyfriend has been working from home at random because of the pandemic. So juggling schedules, trying to figure this out and trying to find a good time was also a little bit difficult. But in my processing of ADHD, because as I said, I haven't been able to get those fancy medications yet because I'm not officially adult diagnosed yet. One of the tools that I have been using to try to get organized and get this podcast set up, which I'm doing better. My daughter got me a lovely planner, which is designed for people with ADHD to help us get organized. So I have the Clever Fox Daily Planner now, and it helps you set up your goals and do routines and all that kind of thing. And I'm working on it. It's not perfected yet. There's one of my pages. And for example, this was supposed to be recorded several days ago, but things got in the way. So this is to keep me coming back to things even when things don't go well. The other thing that got in my way for a little while is I had a bad fibromyalgia and arthritis flare-up. Hard to say what it was, but I was in a lot of pain. And luckily, it had been a while, so my rheumatologist was able to prescribe a 6-day course of prednisone. It's not good to take steroids on a regular basis, but sometimes it can bring down a flare-up and set things right for a little while. So I'm finally feeling better. So let's unpack this. This is not medical advice. It's not psychiatric advice. I'm just telling you about my experience, what's working for me and what's not working for me. So the primary reason why I pursued EMDR is for my post-traumatic stress disorder, or more specifically, complex post-traumatic stress disorder. And I'm going to give you a trigger warning right now, because some of what I discuss might be upsetting for those of you who have experienced childhood trauma. Complex post-traumatic stress disorder generally happens when repeated abuse happens when a child suffers the trauma, as opposed to an adult who had a nice, safe, established home life, and then they went off to war, or they experienced a rape, or they were in an accident or something like that, which can cause PTSD. It's complex because some of the coping mechanisms that you develop as a child can help you in dealing with PTSD later in life. But if you didn't establish that baseline of security as a child, it makes things more complex. So that is what I have been dealing with. It took a long time to understand that that is the diagnosis, that is what I've been dealing with. I was also diagnosed with depression, anxiety, a large part of my younger years I was suicidal, and I had been dealing with the fact that I was sexually abused by my father, and my mother didn't really, she didn't intervene. It's not that she necessarily knew what was going on. Maybe she did have an inkling, maybe she didn't. There's some blame there because she was an educator. They were divorced, so the abuse happened on visitations. It wasn't like she was witness to it, but she was a teacher, so she had been trained in how to recognize this in children. So there's some conflict there as to why she didn't recognize it or seek help for me sooner. There are a lot of emotional things that I've been dealing with, and I want to do a shout out to the Affordable Care Act, because thanks to that, I was able to get psychiatric care and started going through therapy and got a really, I'd gone to different therapy sessions and over time from my first suicide attempt at 14, and didn't really get a really good therapist who understood what was going on until I was in my 40s. And she's truly wonderful, has helped me, you know, logic through a lot of things and process a lot of things and sort of figure out where I was. As I'm going through this healing process through therapy, I'm realizing, you know, there's just damaged pathways in the brain. And as another thing is I have chronic insomnia. So my insomnia has been around since, I mean, I can remember when I was just a child. I have an whole episode on all of the stuff I do to manage my insomnia as well. I'll add to that a couple months back, I was prescribed gabapentin, which also helps with nerve pain and it helps with sleep. And that has improved my insomnia a lot. So if you're an insomnia sufferer who, especially if you're a woman, because apparently it's tied into hormonal changes too at a certain age, and that could be part of it. But the insomnia was also tied to the abuse, because I was abused very young and I was abused at night. So it was kind of, I was afraid to sleep, I guess. So there's that psychological aspect also. And as I'm realizing that some of these traumas are developmental and understanding how the brain forms, and also the requirement of sleep to restore your brain. And there's other things that tied in with EMDR I'll explain in a moment. I explored psilocybin or magic mushrooms as a way to deal with my anxiety. I had done some research about ayahuasca, because I've heard people can start healing trauma, deal with PTSD and stuff sometimes if they go on an ayahuasca journey, because it helps to like reconnect brain pathways or something. So I started looking into that, but obviously it's not like it's easy to travel to some foreign country where you can get an ayahuasca journey. So then I stumbled into the similarities of ayahuasca, psilocybin, and psilocybin therapy is being used as a way to treat PTSD. They're experimenting with it, but of course, since it's a controlled substance, most places, it's really hard to get that therapy at this moment. But as I live in the Bay Area, I found out that there is a church of healing plants, basically, in Oakland, and Oakland had decriminalized magic mushrooms. So I tried psilocybin for my anxiety, and it really, really worked. My anxiety is way down. It's been a big relief. You know, I'm not saying it's completely gone or I'm 100% cured, and I'm certainly not suggesting anybody like jump right into psilocybin. As I said, I've gone through a lot of therapy and working through a lot of things before I went that route, but it did improve things. These are some of the things that I was doing to try to sort through what was going on, and then I heard about EMDR, or eye movement desensitization reprocessing therapy. So what is it used for? It's used for depression, anxiety, panic attacks, eating disorder, sometimes addiction, or substance abuse problems, sleep disorders, and PTSD. And of course, I've got a few of the things on that list. So it seemed like it could have some good potential. So I don't know how much you know about sleep, but being an insomniac, I've done a lot of research about sleep. And there's a process of sleep. Sorry, dog snoring. REM sleep, or rapid eye movement sleep, when a person, it's oftentimes, I think when you're dreaming, you'll see a person's eyes moving back and forth under their eyelids. Psychologists are starting to realize that during that time of sleep, when you're in REM sleep, your brain is processing the events of the day, and your dreams are part of this. Sometimes they don't make a lot of sense, but what happens is you go through your day and lots of stuff happens, and you have memories and events occur. Sometimes they're traumatic, sometimes they're perfectly normal things. And then when you go to sleep at night, your brain takes apart those experiences. So if we're talking about a mildly traumatic experience. So for example, you go to school and some kid is bullying you, calling you names, pushing you around a bit or whatever, and it's kind of upsetting. But you go home, you go through, you have your dinner, you're there with your family, whatever, and then you go to sleep. Well, your brain takes that experience and says, okay, these are the things that happened, and what can I learn from this experience? You know, maybe I'll walk with a buddy down the hallway so I can't be harassed by that bully, or maybe this will be the thing that I say next time, or there's some sort of little bits of information you can get from that experience that might protect you in the future, and those kernels of knowledge are taken out, and the rest of it kind of fades into the background. I mean, you can remember it, but it's not like you know every little detail. It just kind of fades away. So we have certain events that stick in our mind more about what happened in our life, depending on their level of significance. For example, let's say you were 10 years old and you fell out of a tree and broke your arm. You probably remember that. You probably think, oh yeah, I remember when I fell out of the tree, that really hurt, and then we went to the hospital. I remember that part. I remember my cast and people signed my cast and stuff. But you don't remember like every single detail of that moment. You don't remember exactly what kind of tree it was and what time of day it was, and you don't remember everything about the moment. So let's take another example. You fell out of a tree when you were 10 and you broke your arm, but you remember every single detail of it because you didn't just fall out of the tree. You had been warned not to climb the tree in the first place. And after you fell out of the tree, instead of immediately rushing you to the doctor, you got your bottom spanked with a switch because you've been told not to climb the tree in the first place. And you were told not to be a baby and not cry about it. And your arm continued to swell for several days before you finally went to the doctor. And then when you went to the doctor, you were forced to lie and say that it happened the day before. You didn't tell your parents about it because you were afraid you'd get in trouble. See, there's stacks of lies and trauma and everything built around that event. And you remember everything. You remember the type of tree, the time of day, the month it was. You remember everything. You remember what you did at school right before you broke your arm. You remember all these bits and pieces because it is a trauma-based event. So when you are a child that is raised in an unsafe environment, where you can't properly process things and there are multiple things stacking up, things happening on a regular basis that are really traumatic, those events get encapsulated and they don't process like they're supposed to. Instead of remembering the essence or a lesson of something, they get like cemented. And this happens with PTSD of all varieties. When a trauma is really severe, it's like it also gets cemented in your head. So instead of just saying, oh yeah, I was in a car accident last year and I broke my arm, or, you know, whatever happened, and being able to look at it objectively and know what happened and say, oh yeah, well, I'll make sure that I check the brakes next time, or whatever your solution is, the lesson you learned from that event. Instead of processing it in that way, it is encapsulated like a traumatic childhood event or something that takes place in a war. So when you think about the car accident, you remember every detail. You remember, you know, that you spilled coffee. You remember, it's like, and some of you may have experienced this, certainly in an auto accident. I had one that it wasn't particularly traumatic, but I remember while the accident was happening, it seemed like it went on forever. I had a lot of junk in my car. Things were swirling all around me. It seemed like it went on and on. And your mind does that. It like grasps every detail, and it just holds on to it. So then when you remember it later, the feelings of the event are there too, the trauma, everything. It's very upsetting to you. And it can be like that you're just afraid to drive a vehicle because you're terrified that this event is going to happen again. So that would be like PTSD for a car accident. So in my case, because mine was involved with childhood trauma and abuse, and then additionally, I think it was compounded by the fact that I wasn't able to sleep. So even if some of the events, because there were other traumatic things that didn't get processed, like daily bullying and those kinds of things, which compared to the abuse were pretty minor, but they're cemented in there too. So I wasn't able to take apart each of those little bits and pieces and put them where they belong. So for me, I like to compare it to some big old house. And there are rooms that I've stored different memories in. And then that kind of encapsulates a part of me. So there's me until about age 7, and that has a room where there are memories, and that's her room. And then there's me from about 7 to 12, maybe 13, and she has a room, and it's kind of a separate room. And then between 14 and 19, there's a different room, and it's like that. So my personality in some ways is fractured. I mean, I know those are my memories. I'm not, you know, I don't have a psychiatric disorder and then they're separate people. I understand that they're all me and there's a connection there. But they don't feel connected to the me now. The me now started around the time of therapy, I guess. So with my regular therapist, I'm trying to integrate this, and EMDR is a way to kind of break apart these memories and integrate them so that when I go back and I open that door and I look at an event that took place that happened for little girl me, I don't get sucked back into the memory as if I'm, you know, trapped in this snow globe of, oh, that's what it feels like. But I can look at it objectively. So in EMDR, it's very different. If you've experienced any kind of therapy where you talk through your feelings, you bring up a moment and then you sort of break it apart, you know, what was going on with your feelings and you know, what can you remember about it, and you talk it through, and then you think about it and you try to look at it from a different perspective, and I've done a lot of that with a lot of different things. But with EMDR, it is more like you pull up one single moment, or in my case of the most recent session, because we're finally getting into it. I should go back and explain. Before you get into the actual what it is, there's some work that's done. They kind of talk to you about your history. You work to develop a safe place. Well, mine is a calm, safe place. And so you try to visualize a place that you feel comfortable in, whether it's made up or whether it's real. And so that's where they try to bring you back to try to calm you down, because it brings up a lot of stuff. So you work through a little bit before you get to the nitty gritty of it. And I'm sorry, I'm being interrupted. Hi, Chewy. This is my therapy dog in training. Hi, Chewy. He's a good boy. Don't be distracting or you'll have to get down, okay? Be a good boy. You're a good boy. So, where was I? Ah, yes. Okay. So once you get through the base part of it, then you get into actually processing things. And what we processed last time was a trigger. I'd watched a show that had a very sexual scene between a teenage girl and an old man, and it set me off. It sent me to a really dark place, and I got really upset, and so we started there. And during the session, the way they do it, the way the therapist will do it is with tapping, bilateral tapping. Oh, and another sidetrack. Apparently, Prince Harry recently talked about it on the Oprah show, that he has been getting EMDR therapy. That episode that we're talking about to cope with his mother's death. So he talked about a little bit about one of the processes. So one of the processes is to do tapping. And so tapping would be, it's bilateral. So you've got your hand on either side, and then you tap. And you tap gently. And then the therapist asks you to recall this feeling, whether, hi, I like you too. So in this case, I was recalling what I had seen that upset me. And she will ask, what is your level of distress when you think about this? So before you start, you think about your level of distress. Okay, well, go on, buddy. And you think about your level of distress, and then you just tap and you think about the event. And then something really weird happens. You start, Joey, you start to have feelings. And when you're doing that, also your eyes will move back and forth. Like when you're doing the tapping, your eyes will be closed. And I assume the therapist is observing your eye movements, and she brings you out from time to time. She's like, okay, stop, open your eyes. What are you feeling? What's your level of distress? And as you're doing this, you'll feel it in different parts of your body. For me, it's oftentimes in my gut. But then it changes. Sometimes suddenly it brings something up and I'm just like crying. And it's bringing back different memories. Unexpected things that are tied in that you just don't even know where that came from. And a lot of times, another thing is pain and pressure in the chest is another thing that will happen. So sometimes it moves on beyond the tapping, and my therapist has moved on beyond the tapping. So now in the sessions, what she will do is, because I'm not sure, it would probably be very different if we weren't in pandemic times and I was able to go into an office. But right now everything is done during Zoom calls. So what she'll do is she basically moves her head out of screen and she has me follow her fingers while she has me think about a thing. And during the last session, it was really interesting. As I told you, I told you where I started, and where it got to by the end of the session was after the pain moved down to my gut, and then I felt nauseous, and I had a realization that the stomach problem I had in school when I was a child, I used to have, my mother used to tell me I was lying to get out of class, but I used to have terrible stomach pains, And for a while, the doctor thought maybe it was an ulcer. It was because I was, it was anxiety about lying, because my father forced me to lie about what was being done to me. And so that was an additional trauma. The lies became a part of the whole traumatic experience. And I mean, it makes sense. I mean, even now, I really don't like being dishonest. Even if it's a restaurant person asking how I liked the chicken, it's a bit bland. Sorry. But it's a weird way that it roundabout gets there. And what it is this eye movement thing, this bilateral thing, is breaking apart these memories and helping you reprocess them. So it's been very interesting. I would say that a lot of progress is being made very quickly through this technique, more quickly than it ever was with cognitive therapy. I'm very hopeful that it's going to help me get through some stuff, and especially hopeful it will get me sleeping better. And that's another part of the process, though, that is really weird. It's like after a session, I was just exhausted. I mean, I felt like I hiked for miles. And I've been warned about that. My therapist said, well, you know, you've been through an emotional marathon. In that short little 1 hour session, you're up and down, and it's just, it pulls into things. And, you know, it's not an easy thing. And she also warned me at the beginning of this that I would probably be experiencing weird dreams, and it can shake loose memories of things that you'd forgotten about. And that part's a little bit scary, I guess. I've often talked about the abuse. It's a little like if you get a splinter, and if you get a splinter, and it's a bad one, it can hurt. And then you dig it out, and it hurts for a while, and then it heals. But if you get a splinter and it's way down deep in there and you ignore it and it heals over, eventually it starts to surface, and it's infection, and it's pussy and disgusting and oozy, and you really have to dig in there to try to get it out. And you just have to pick at the pieces. And that's kind of what it feels like in dealing with the childhood sexual abuse, because it's, you know, there's still bits and pieces of it in there that I've been digging at and digging at and digging at, and then you think you get it all, and then it just, it festers again. My hope is that one day we'll get it all out of there, and I'll figure it all out, and I'll decipher every last bit of it and process it and come to a place where I can feel safe and I can sleep like a regular person. I mean, if I had one wish from a genie, it would be, I would like to be able to like go to bed at night and sleep without any supplements or any medication, get a good night's sleep, and wake up in the morning feeling like a refreshed human being. And yeah, I've never had that, thanks to supplements and certain medications and being in a safe home now, and having my therapy pets. This is Chewy, by the way. This is Chewy. He's in training. He's still got some work to go. So I'm hoping I will get to that place, and I'm still working on it, and I'm sharing my journey with you so that if you're in this spot, you're dealing with some of these things, you'll understand how EMDR works and how it might help you. Or maybe there's somebody that you know and care about and want them to be able to get through their traumas and their addictions or depression or anxiety. And I do hope that you will share this episode with them so that they can learn something from it. And before I go, I just wanted to do a little bit of an update of one of the things that I had to deal with recently, just to share it with you. Some of you folks, as I said, Chewy is my therapy dog in training. Hold on just a second. This is Snacks, and Snacks has been my therapy dog for the last 7 years. Oh, Chewy. Oh, Chewy, you're just so wild. Just relax a minute. So this is Snacks, and Snacks had a health scare over the holidays. I turned him over to trim his nails, and one of his testicles was ridiculously enlarged. I mean, like 5 or 6 times bigger than the other one. So we had to take him to the vet, and we didn't know if maybe it was cancer. We really didn't know. But see, Snacks is an elderly dog, and he has some heart issues. Hello, Chewy. And so Snacks hasn't been able to get his teeth cleaned for a while because of his heart problems. There was a risk that putting him under, he might not survive the surgery. So it was a lot of worry, but he went in and he got his surgery about a week ago. And as you can see, he's doing just fine. And they took out a nasty tooth. So Snacks is doing great, and he's gonna be around for a while so he can train up this other pup who's still a wild child. And I know some people don't get the whole concept of emotional support pets, but I can tell you that when you've got insomnia, in part because of fear, having a little guy to warn you in the middle of the night makes a huge difference. And Snacks is really good about showing up from any part of the house anytime I'm upset about anything. Chewy's learning to do that too, but sometimes he kind of chews on me. Hence the name. Well, that and Chewbacca. We're Star Wars fans, in case you hadn't guessed. So thank you so much for joining me and learning about EMDR and a little bit else about some of the things that I'm doing to try to work my way through some of my stuff. And I hope that the next episode will be a lot sooner as I'm trying to get organized. And I hope to have a whole episode about ADHD, particularly in adults, and a little bit more about the diagnosis differences in women, because ADHD in girls and women is often missed. Thank you very much for joining me for Unpacking Life's Crazy. Again, share this with your loved ones if you think it can be helpful. And if you have questions, please feel free to leave them for me, and I will get to you just as soon as I can. And go to esperanzaphoenix.com. And until next time, take care of yourself and the ones you love.